Thank you all for your presentations and your very thorough written testimony. We really appreciate your taking the time to be with us today. We'll now begin the questions. I'll start with a couple of questions from myself. Let's see. So I'm going to start with National Indian Education Association, Mr. Dropik. I want to talk a little bit more about the construction, and I really appreciate your reminding us of the importance of expanding those construction funds and how far behind we are. Certainly during the pandemic, we were reminded of how inadequate the facilities are everywhere. A few years ago, the Bureau of Indian Education developed a new methodology for determining school replacement and repair needs and priority. While this new methodology seems promising, GAO and some tribal schools have questioned the accuracy of the data used to determine the needs and priority. So is your organization engaged with BIE to ensure adequate funding and training to provide technical assistance to schools to ensure the data is input accurately and timely?
Yeah, thank you so much for that. That's a great observation. I would just make 2 points. One is that NIA is always standing ready to help support whenever we are asked or called upon or invited to the table, so to speak. We would love that opportunity to share more. I would say that often, sometimes those decisions seem to be made in isolation, not always with consultation, not only with NIA or even BIE at times, but also tribal communities that they serve. We really feel that communication has to improve. It does not take place in the way that it should. The other just real quick point is that also, funding in terms of structures isn't just a BIE issue. Our structures and functions in public schools and the gap that we see with over 93% of our Native students attending public schools, those gaps are huge and continue to further separate. And so though we specifically make those asks as it relates to BIE funding, obviously from oversight perspectives, there is much need to be done on infrastructure and resources across all schools where students are. And lifting up those Native, predominantly Native schools lifts up all students in those communities. So it's really should be a win for all communities.
Yeah, thank you for your answers and also for reminding us that all of our public schools need upgrading. Coming from New England, where so many of our school buildings are old, we are acutely aware of that issue. Ms. Sharp, I wanted to just ask you a quick question about climate change. So we all know that Indian tribes are facing the enormous challenge of confronting the threat of climate change and the impacts on air, water, land, communities, human health, species, and habitat. So the FY 2023 President's budget includes an additional $29 million over the 2022 enacted level for climate adaptation and tribal relocation. Could you describe to me some of the challenges that tribes are experiencing and how climate resilience funds would be used to adapt to climate change?
Yes, excellent question. Thank you. I really appreciate that. We are on the front lines of climate change. Recently convened an NCI board meeting, and we go through what's going on in Indian country, and every region reported climate-related impacts. So all of Indian country is directly impacted, and I could speak specifically to my tribe. We're currently under 4 states of emergency. We face a massive king tide. A landslide threatens to take out the only access road to our village. And so we really appreciate any funding and attention. And the dollars that we would use would not only help relocate our villages, but we're also facing the collapse of our fisheries in the Pacific Northwest. These are issues that are key and central to our identity as Native people. And the visuals from last summer when we had temperatures of 111 degrees, there's video footage of salmon being cooked alive in the Columbia River, heat lesions and clam resources when the tide went out were just baked in the open sand. So we are on the front lines, we are threatened, and these dollars will be able to help fuel and fund our ability to adapt and mitigate these direct impacts of climate change. I really appreciate the question. Thank you.
Yes, thank you. I think since there's $8 million specifically for tribal relocation, and you graphically described how it impacts your tribe, I think we have to dig in deeper onto that and understand the number of tribes that need that level of assistance and really just how big the impact is going to be over the coming years. I've used up most of my time, but I'll get a chance again later to ask some more of your questions. So I will yield back and then see if Mr. Joyce has some questions he'd like to ask.
Once I figure out how to get back on this. Thank you. And I continue to follow up with Ms. Sharp, if you don't mind. President Sharp, of all the proposals in the president's budget that touch on this subcommittee's jurisdiction, is it fair to say that the mandatory funding for IHS is the most consequential?
I would say yes. Coming out of a global pandemic, the Broken Promises report detailed the level of funding. There's a data point in that report that says per capita, the average investment through IHS for individual tribal citizens is just over $2,000. The national average is over $9,000. That chronic underfunding is what led to our vulnerability. And so coming out of the pandemic, it's absolutely essential that we have mandatory resources as we plan to not only recalibrate the mental health crisis that's not even known at this point, but we know it's there. It's absolutely essential that we can have funding that we can rely on. That's mandatory for planning purposes and to redefine a healthcare system that's responsive to our citizens.
The mandatory funding proposals for the IHS contract support costs and 105L payments for tribal leases technically fall under the jurisdiction of the House Natural Resources Committee and not the Appropriations Committee. What is the NCAI doing to help move these proposals through the authorizing committees?
Yes, we are working diligently as a Congress, but we're also working through our regional organizations that you're going to hear from tomorrow. So we know that we have to hold the United States accountable to its trust responsibility, and that, as I pointed out in my testimony, these are chronic, longstanding, underfunded programs. And so we have to work at every level with every region and do the fact finding that we've been doing for nearly half a century at NCAI, and be able to provide that technical support to our regions, to our individual tribes, so that we can aggressively work to insist that these are mandatory. These should not be discretionary dollars. Our basic health should be a mandatory expenditure of the United States government.
Great. Well, Madam Chair, I know we have some other members on there. I'll stick around with you for round two and let them get in the questions that they may have.
Great. Thank you so much. I think the next member up is Mr. Kilmer.
Thanks, Madam. Thank you, Madam Chair, and thanks to all of our witnesses for being with us. I wanted to start by directing a couple questions to my friend, President Sharp, who's been just such an extraordinary leader in our neck of the woods and nationally with the National Congress of American Indians. You know, the chairwoman in her question touched on the impact of climate change, the impact of rising sea levels, and you already spoke eloquently about what that has meant for the Quinault Nation. You know, you've seen, if anyone goes online and Googles Tohola, which is their lower village, and flooding, you can actually see a photograph of someone rowing a canoe through the streets of their village because we've seen storm surges and flooding. You know, unfortunately, in the district I represent, we have 4 coastal tribes that are in the process of trying to move to higher ground. In the omnibus bill, there was some funding for the Hoh tribe and the Quileute tribe and the Quinault Nation to support some of that relocation process. We're working on some other stuff. The Natural Resources Committee favorably reported out the Tribal Coastal Resiliency Act, which they introduced to try to provide some dedicated resources to coastal tribes to support their efforts to mitigate threats caused by climate change. But I think it is worth just pointing out that these are significant costs. I mean, we're literally talking about trying to relocate, in some instances, entire communities. You know, if you go out and visit the Quileute tribe, their school, any one of us could stand at the doorstep of their current school and throw a rock and land it in the Pacific Ocean right now. And, you know, if you think about the threat of tsunami, that's horrifying. And, you know, so building a school is not a cheap ticket. And then you multiply that by all of the communities that are undertaking this. So, President Sharp, I was hoping you could say a bit more about how BIA and any other funding advancing climate resiliency would help in these relocation efforts, and what you think Congress ought to do on this front, because my sense is both the need is far more significant than the funding has been.
Yes, absolutely. Thank you. When we did look at the budget that was released, the infrastructure bill, for example, there's $150 million for relocation for tribal nations. Our one project at Quinault is about $180 million. So the national appropriation for relocating tribal villages that's targeted for tribal nations, my one nation would consume that entire budget. So the need is tremendous. And if we consider the report that was released just yesterday by the United Nations, our reality today is only going to intensify. The climate crisis with respect to sea level rise, mega fires. And so the public treasury right now, from our perspective, is paying for the mere symptoms of climate change. We're not even getting to the concrete, the infrastructure to actually move these villages to higher ground. We're not getting to adaptation and mitigation strategies. So my recommendation going forward would be to make targeted investments to make a difference, but also to recognize the scale of this crisis is beyond the public treasury. We have to be creative in public-private partnerships with the private sector and also with philanthropy. There's a global community waiting to enlist resources and deploy those to tribal nations. And I think the United States could be a tremendous partner and ally with tribal nations. In other parts of the world, Indigenous peoples don't have political structure. We do. And so I think there's an opportunity to meet the needs here domestically, but also to be a leader globally on these issues with respect to Indigenous peoples.
I'm going to try to squeeze in the minute I have. You mentioned the Broken Promises report, which really details, as you pointed out, chronic underfunding in infrastructure and housing and education and healthcare and economic development for tribes. And in many cases, failing to fully recognize the sovereign status of tribal governments. I'm working with Senator Warren on some legislation to address some of the recommendations outlined in that report. But President Sharp, can you just comment on the importance of actually taking action in response to the Broken Promises report?
Yes, thank you. And I appreciate that question. I'll try to answer it in 20 seconds. It is critically important that we consider this as a foundational document. There's a lot of fact finding. It determines not one federal agency is living up to its trust responsibility. So we need a partner. To the extent Congress cannot fully fund these services, you need to get behind our vision and building our economy, including tax parity and our resources to, as sovereign nations, raise the revenue and advance profitability of our enterprises. Sioko, thank you.
Thank you. Thank you, Madam Chair.
Very well done. Thank you. Mr. Simpson, you're recognized for 5 minutes.
Thank you, Madam Chairman, and thank you all for being here to testify today. Obviously, Indian health and
We lost you for a minute. I think maybe you got muted.
Can you hear me now?
Yeah.
Okay, we're back again. But anyway, thank you all for being here today. Indian issues in Indian country here has always been a bipartisan issue on this committee. We've worked together and tried to do the best we can. I noticed almost all of you recommended that we do mandatory funding for Indian health services. It was also mentioned that we do advanced appropriations. Now, if you had mandatory funding, do you need advanced appropriation? I guess I'll ask whoever wants to answer that.
I'd be happy to.
Okay.
Yes, both are critically important. Mandatory means the United States is signaling to tribal nations treaty obligations and the trust responsibility is non-negotiable. That's right. Mandatory. Advanced appropriations is also vitally important to tribal nations so that we can plan. It's hard to plan for things when we don't know, when there's such a level of uncertainty all across Indian country, and specifically to the health sector. When you look at every single metric of public health for tribal nations, our citizens are off the chart. So we need these resources and we need them in advance so that we could plan effectively.
Well, I appreciate what you're saying, and I agree with you that Indian Health Service has been underfunded for years, and we've tried to increase it and so forth. But if it was mandatory, you'd pretty much know what it's going to be the next year. So, I mean, it seems to me like, maybe I'm wrong, I don't know, but maybe it seems to me like if it was mandatory, you'd have that certainty rather than through the advanced appropriation. But that's a discussion we can have later on, how best to do that, because I understand where you're coming from and I agree with you. Let me ask you, if if mandatory funding were in place today, say it had been passed a couple years ago, would the 9.1, what is it, the 9.1 billion in mandatory funding for IHS be sufficient to cover those costs today? Or would that level be higher today?
Yes, it wouldn't be sufficient. As I pointed out in my one of the previous questions, the disparity is so wide, the gap is so significant. It's going to take us years just to get to a basic level of healthcare. And when you look at our healthcare delivery systems in IHS, we have the resources to fund doctors, pharmacists, but do we have a comprehensive healthcare system that includes oversight, that includes quality of care, that includes access to care? A lot of these basic features of a comprehensive public healthcare system does not exist in Indian country. So for us to achieve a basic level of parity with citizens in the United States, we need far more than what is currently appropriated.
I understand what you're saying. Believe me, Representative Cole has made me aware of this over the years and the need to increase funding for Indian Health Services. It seems like if the authorizing committee passed mandatory funding, that the idea behind that is it brings that level up to where it ought to be because it's mandatory, and it does it right away. In this, from what I understand in this proposal, it's 9.1 billion in mandatory funding that will increase based on healthcare costs and population growth to 36.7 billion by 2032. Does that I'm trying to figure out mandatory at what level and how do we anticipate those costs? And the reason I ask this question is, as you know, about little over 70% of the federal budget is mandatory funding. Every agency in the world would love to have mandatory funding and not have to deal with the Appropriations Committee. Believe me, I fully understand that. And it might be the only way we can get Indian health up to where it ought to be and the funding for where it ought to be. And I don't have a problem with that if that's what's necessary in order to get it to that level. And I guess I've been trying to figure out at what level would it jump right away, and how soon would we be at full funding under mandatory funding?
Yes, I really appreciate where you're going with that question, Congressman. I really appreciate thinking about not only meeting the immediate need, but the long term, and how do we get to a level of parity. And I would welcome, and as I'm sure all of our partners and colleagues who do some significant fact finding, we are coming up to an era of understanding the boarding school deaths within our community and the murder of our children. There's significant mental health crises facing Indian country. At this point, we don't even have the resources to fully understand the scale of the healthcare crises facing Indian country. And to answer your question, we should spend the time in partnership with Congress to really delve in to understand the significant right now health impacts to Indian country, and then from there build out. So I really appreciate the question. Thank you.
Yeah, I appreciate your answer, and I'm more than willing, and I know members of this committee are also, to figure out how we get to the level that we ought to be at so that there's not disparity between Indian health services and other health services delivered by the federal government and stuff. And we, as you said, we have a treaty responsibility with these tribes, one that I'm painfully aware of, that's necessary that we try and meet. One other question, I can't see a clock, Chairwoman, so this is a briefer question.
Go ahead. Sure.
And when it comes to Indian education, and it's broader than just that, one of the problems that, as I talked to like the Chauvin tribe in Idaho, they have some difficulties hiring teachers. And it's not just teachers, but it's also law enforcement officers. We just had an earmark for a $7 million fire station in Fort Hall because they needed a fire station. The one thing they told me is they have a hard time keeping the firemen on the job. They got like 20 or 30 firemen, but they are the training ground for the communities around that can pay these people much more. So in Indian education, law enforcement, other first responders, they do all the education. As soon as they get educated, a lot of them will move to other communities. How do we create a situation where they can pay these people to stay on the jobs that they've been trained for on the reservation.
You can go ahead, President Sharp, if you'd like. Otherwise, yeah, I can either way.
Yes, I could address law enforcement if you want to address education. With respect to law enforcement, you see that all across Indian country. The one suggestion I would make as we try to achieve parity with state and local government, we need parity not only in the number of officers, but in pay scales. And I've often thought, would it be nice to take the federal pay scale and include those in our self-governance compacts? We have our fish hatchery, somebody who's been there for 30 years, and they're still not at a level that's even at the lower end of the federal scale. When someone from college comes right out to our federal hatchery, they're making about $30,000 more. And you're right, you could go to every sector. And so if we could achieve parity, take federal pay scales, plug those in, we would be able to see a sustained effort to be able to deliver public health, safety, education, welfare for all of our workforce. It's so important.
And just following up on that on education, you're absolutely right. And education and having teachers in the classroom isn't going to be an issue that is solely in Native communities, but it definitely is going to be, once again, a huge spotlight and exacerbated by when you have poor conditions, you have people wearing multiple hats because of funding deficits that create the need for people to serve in many different roles, as opposed to in their other community peers where they don't have to serve in 3 to 4 different roles in their communities. Those are some of the challenges that come in. So, there's many different ways that you can help to support that, and both of that through funding, obviously those core structures, which helps to create opportunities then for personnel where the huge gaps that we talked about in our testimony that exist between personnel deficits, but then also we can get creative. There's programming, and it might not be specific from appropriations, but really being able to pass some meaningful ways in which tribal members can be able to get their degrees without a huge burden of debt over their head as they go into their communities and they work in a payback. I graduated from a federal program that created urban American Indian teachers, and I was able to get part of my schooling paid for to serve in urban American Indian settings. And those programs are so few and far between and poorly funded that they just definitely would help provide some impact into our tribal communities. But it's structural, it's personnel, it's creating those, and it does start with funding, as well as creating those conditions for people to stay.
Thank you for that. And let's work on that. I'm more than willing to work with you. Thank you, Chairwoman Pingree.
Thank you. Thank you, Mr. Simpson. I let you go a little bit over, but you got the rest of Mr. Joyce's time. So I'll make it up to everybody else. Representative Lee, you are next.
Thank you, Chair Pingree and Ranking Member Joyce and all the panelists for being here today. I represent Nevada, and over 80% of our land is federally controlled, which means that tribal collaboration and participation in federal lands management is such an important issue in my state. I personally have been pleased to see the Biden administration's commitments on this front with the Tribal Homelands Initiative and Secretary Holland's new Tribal Advisory Committee. Those are all a great start, but as we saw from or heard from testimony today, much more work remains. I have a pair of questions for Ms. Sharp on this front. President Sharp, my district is home to Bikwame, which is the Mojave name for Spirit Mountain, the center of creation for 10 human-speaking tribes. Right now, a coalition of tribes, the local communities, the Nevada legislature, conservation groups, recreation interests, and others are working to establish Spirit Mountain in the area that surrounds it as a national monument. And earlier this year, I sent the secretary a letter supporting such a move. You spoke in your testimony about creative management solutions to the tribal federal partnerships when it comes to federal land management. We already know that there's 4 sites in the National Park Service, as well as 80 additional formalized relationships. From your perspective, are there successful models of formal federal and tribal cooperation that could be or should be considered when creating a new monument such as the Bikwame?
Yes, absolutely. And before I answer that specific question, I think it's important just to point out that while tribal nations ceded millions of acres of lands across this country through treaty, we've never relinquished our spiritual connection to this landscape. And that's what we bring to the table. When we bring our co-management, we bring our perspective, we bring our teachings, we bring our songs and ceremonies that remain, that have been there since time immemorial. So yes, there are examples all across Indian country where we are able to not only be at the table, but to bring that wealth, that brain trust, and that heart and that spiritual connection to the landscape. And you'll find in those instances, the management is it's just better. It's an added layer that connects present day management to the beginning of time and our vision to the end of time, because we do manage for 7 generations. So we bring that very broad perspective. I really appreciate that question. Thank you.
Thank you. Are there any specific characteristics that you would believe would be essential to ensuring a productive co-leadership of tribal lands?
Yes, one of the key features I would strongly advance is the ability in co-management for tribal nations to have a decisive say over our land, territories, resources, and people, to have what is known as a universal international standard of free, prior, and informed consent. When we have the ability to have decisive say over our lands, territories, and resources without another sovereign taking unilateral action, that's when you're going to find that the relationship between tribal nations and the United States is not only respected, but advanced in a way that's honorable and that's worthy of things that are in the future that we can achieve together in a good, positive way.
Thank you. You know, I did want to comment about your previous answer. I had the pleasure of touring Spirit Mountain with the local Fort Mojave tribe and witnessing their dance and their ceremony, and it was really quite moving. So, you know, the Biden administration has the Tribal Homelands Initiative, and this is a historic commitment to upholding and enhancing the federal government's partnership and nation-to-nation relationship. As this effort continues to get underway, what elements should Congress prioritize in the near term that will best position this initiative for success in the long term?
Yes, I think a lot of the issues that we've touched on have been related to funding, to co-management, to having a decisive say. I think it's important to spend time to really understand the tribal nation's perspective. I think in oftentimes when there are new initiatives and innovative ideas, a lot of people think they have an idea of what would work for us or what is best for us. And that's been the long story of federal tribal relations. But to the extent there's some early engagement to really understand issues from our perspective, that little investment of time is going to be proved to be valuable for years to come.
Great. Thank you, Ms. Sharp, for that insight. And with that, I yield.
Thank you very much. Mr. Amadei, are you interested in asking questions? I'm not sure if I see you on there. Okay, I don't hear back from Mr. Amadei. If he wants to ask questions later, we'll put him back in the line. So we'll go to Mr. Cartwright.
Thank you, Madam Chair, and thank you for our distinguished panel for testifying today. I want to talk about broadband internet. We're all talking a lot about that, but we have to talk about it in context with this hearing. Ms. Sharp, I want to start with you. In January, one of your NCAI colleagues, Mr. Rantanen, told the Senate Committee on Indian Affairs that half of the tribes did not apply for broadband funding, in part because they were unaware of the funding opportunity due to the lack of connectivity. In other words, they weren't online, so they didn't get the notice. Well, as we begin to build out better broadband access with the IIJA funds, how do we ensure that these tribes and communities who clearly need the funding are aware of the opportunities available to them?
Yes, thank you. And I'm just looking at my screen here. I don't know if my face is coming off as red as it looks on my screen, or if
you look good.
If my blood is literally boiling, I'm not sure. But to answer your question, The one thing that I would recommend for us to really put our broadband programs together, we have to go to multiple sources. If we could create a one-stop place so that we aren't band-aiding the approach to establish broadband, and then also deploy resources to help build capacity. Another reason so many tribes didn't apply, we don't even have the capacity to be able to begin the planning process. And so early dollars for planning, one-stop shopping to be able to combine all of the federal deployment of resources targeted to Indian country in a convenient place, I think that would go a long way.
Well, thank you. And I want to include Mr. Dropik in this discussion. Mr. Dropik, as you noted in your testimony, Native students often face significant hurdles, educational disparities. Can you describe the impact that limited broadband access has had on exacerbating these disparities, especially during the COVID-19 pandemic, and how, if allocated appropriately, the broadband funding in the bipartisan infrastructure bill, the IIJA, can help reduce these disparities?
Yeah, Miigwech, thank you for that opportunity. And you're absolutely correct. So with about 68% of our tribal communities being in rural settings, I can speak firsthand from when we had to pivot to remote learning within our own school. We had students that had moved back to their tribal communities because that's where they had families that could take care of them. So they're out of their city centers with their parents and they went with an aunt or an uncle or a grandparent. And there was zero cell phone signal, let alone broadband access. So we couldn't even give them a hotspot that they could use. And so infrastructure parts of it in terms of increasing access in rural communities. And we know that in the Southwest, the distance and the geographical challenges that exist there for making sure that people have adequate access. What that does is just, there was already a gap. We've seen a gap in communities where that isn't an issue, where they are able to access online, whether it's our suburban community or urban centers. And then also what we did though, see in our tribal community, so that gap further spread as students that didn't have those same issues were able to engage in some connections with other people with meaningful learning experiences that were met. So it's that communication. We got to let them know. But even if they knew, some of our families wouldn't have been able to access that because there's just zero capability in their community. And it's because there has been no investment dollars. If I need a classroom or if I have an opportunity to get some high-speed internet, I need a classroom renovation so I don't have a ceiling tile falling on my head. And so those are priorities. You know, when we make those priorities and we cut funds and infrastructure, other resources, it takes away from other opportunities to grow and to create that access. So I think to President Sharp's point, that collaboration about really researching what is it, where do we need to have those priorities made so that we can make sure that they have access, then we can start getting the tools in people's hands and the communication can go out. So that infrastructure part, getting into rural communities is huge, or tribal communities, which is where many of the lands are, is something that has to be addressed as well.
Well, that's well said, and thank you both for your testimony. And Chair Pingree, I yield back.
Thank you very much. I think we might have a couple of members who want to ask second questions. I'll try one more time. If Mr. Amadei wants to ask a question, just let me know. Otherwise, I will go back and we'll go with a couple more questions. And I'll start with myself. I wanted to ask Ms. Tetnowski, in your testimony, I thought it was interesting that there are only 2 urban Indian health facilities for the entire East Coast. Is that because of lack of funding, or are there other urban facilities provided or interested in providing health services, but that are not able to do so because of the funding? And what would be the process or what's needed to expand Indian healthcare on the East Coast?
Thank you so much for that question. Yes, it does have to do with our ability to get additional funding to increase our service areas. Many of our existing programs were created many years ago, most of which are 40 plus years old as far as organization goes. And so with a 1% line item out of the entire IHS budget, the ability for us to expand into new areas or to create new facilities in new locations is just not possible. We just don't have the bandwidth or the resources to be able to sustain them. One thing I wanted to follow up on what Representative Simpson said about the ability to have advanced appropriations versus mandatory funding. Advanced appropriations would ensure that we weren't shut down during any type of government closure. IHS is currently the only healthcare organization in the federal government that does not have advanced appropriations at this time, again, leading to our inability to expand programs and plan, like President Sharp shared earlier. Planning is critical for those services to expand.
Yeah, thank you for that answer and for your thoughts on the mandatory and advanced funding. Mr. Smith, I want to ask a question of you. In the fiscal year 2022 budget, the Indians Health Service for the first time identified at over $50 million the service pays to the Department of Health and Human Services for assessments. Subcommittee urged IHS to fund these costs from the direct operations line rather than hospitals and healthcare, which is used to provide actual service. Has the service consulted with the tribes about moving these costs, and does NIHB have a position on where these costs should be funded?
Thank you for that question. As it's going, I would have to refer back to my technical support to get you the proper answer for what you need. But on another note, when we're talking about advanced appropriations and mandatory, advanced appropriations would give us the stopgap till we can decide and talk together and work together on the mandatory appropriations, so we'd know the full cost of everything that's doing. So like was stated before, we already suffered when the government shut down. And when you talk about people leaving the jobs, we had health persons leaving our Indian Health Services jobs because they weren't getting paid and going over to the paid section and trying not to get qualified health care workers back into our system. So advanced appropriations would be the solution to figuring out what a mandatory would be, because just saying a mandatory appropriations, we don't know what that would be. But if we had just like the VA, it kept going during the shutdown, but the Indian Health Service, and we suffered dearly. So I'll get back to you with your first question. But
great, that's fine. You can let us know, and thank you for that. I know those of us in government like to think we're never going to shut down again, but it does seem to happen. So I understand your concerns. One last question, Ms. Sharp. In your written testimony, you proposed investments in an economic development pilot program. Could you give me some more details on how the program would work and how it would differ from BIA's existing economic development programs?
Yes, one of the central points of distinction, we know and recognize that healthy tribal economic systems and economy is so much more than tribally owned business. It's attracting companies to locate within Indian country. It's also supporting a private sector economy, our individual tribal citizens. So what we're after is a comprehensive economic development strategy for Indian country that not only assists us in increasing profits, not necessarily governmental revenues. That's a system of taxation, and that's a whole nother area where Congress needs to support our ability to raise revenues. But in the profit sector, tribal nations can compete. We can support intertribal trade. We can gain access to international commerce and trade. We can also build a private sector economy. And so we have to look at economic development within Indian country through that comprehensive lens to know and understand we are a sovereign tribal nation. We could attract companies, we could tax them, we could raise revenues, and we can also create strategies to increase our profitability through commercial ventures and enterprises. That's what we're after.
Great, thank you. That's a really helpful explanation. Mr. Joyce, would you like to ask some further questions?
No, all my questions were addressed by the relevant questions asked by other members, and certainly appreciate you thinking of me, ma'am.
Great. Well, our colleagues have asked some good questions. How about you, Mr. Simpson? Any more questions from you?
Yeah, Chairwoman, I appreciate it. It's not really a question. I'm certain that when this is all over, I'm going to have some staff member, Darren, I'm talking to you, come over to my office and explain to me where I'm wrong or whatever on this. But the question of advanced and mandatory, I still find that fascinating, because you know that if it goes to mandatory spending, it is completely out of our hands then. Just like Medicare, Medicaid, Social Security, we don't appropriate money for any of those things. Once it goes to mandatory, it's mandatory. And that means that, as an example with Social Security, if you get Social Security check, you will get that check regardless of whether the federal government has any money or not. If we have to borrow the money, you qualify for that. As long as you qualify for that, that's what mandatory spending means. And when you say advanced appropriation, I'm sitting here going, advanced appropriation of what? If it's out of our hands, what are we advancing the appropriation for if it is mandatory spending? So we need to work this out so that we're all on the same page, because I'm on your side on what you're trying to do here. We certainly need to get the Indian Health Services where Indians are receiving the same type of medical care that other Americans are. And I think that's something that this committee has been working on, but it is a huge task, as you know. So let's work together, see if we can solve this. And also, I'm very interested in, having come from a city council a town of 10,000, where we had 25 miles away on each side a city of 50,000. We trained all the police officers for those communities. And now we're seeing the same type of thing happening with tribes, where they're training the educators and everything else, and then they're going to where they can get better pay. And we need to solve that problem, frankly. So I appreciate all the work that you all do, and for being here to testify before this committee today. We want to work with you to make sure we get to a good place where we ought to be. Thank you, Chairwoman. I appreciate it.
Yeah, thank you, Mr. Simpson. I really appreciate your points, and I think we've got some sorting out to do on those questions, and appreciate your insights. And to all of our witnesses today, thank you so much. You've been really helpful to the committee and thinking about what we need to be doing in FY23. And we'll look forward to staying in touch as we work through this process. And again, thank you for your work for your organizations and for providing your insights to us. So with that, I will call this committee adjourned.